So one of the new ideas that's really taken over in cancer is a lot of evolutionary thinking is realizing that the cells within a tumor are not all the same, and there's actual selection going on within the tumor, and the cells that grow the fastest take over, which is not good for us. That probably has implications for how we treat things. Is that right?
Yes. I think you're alluding to the concept of cancer or tumor heterogeneity.
Yes, that's right.
So sort of thinking about the tumors as ecosystems or populations,
Right.
where you're not talking about everything being the same within that, but where it's something that's an evolution
Right.
that could change
So this is a new idea for a lot of people. There's evolution going on within the cancer.
That's right. This could be occurring at many different levels. So when we think of a tumor, it's not just the traditional cancer cells, but other cells, immune cells, fibrotic cells, even non-living material that forms that ecosystem. And I think we have to also think beyond human cells. There's also what we call the microbiome, where there's bacteria and other organisms that form a large part of our body that are also part of these tumors that form this ecosystem.
So it's a very different way. I want to go into the ecosystem in our next little segment. For right now, it sounds like if these cancer cells are different from one another, then when you treat them, it's a lot like treating a bacterial infection with antibiotics. Is that right?
That's right. So you could give one therapy. You might kill off the majority of the cells that respond to it. If there's a few cells that have some competitive advantage and survive, now you're left with the same problem all over again.
That sounds just like antibiotic resistance.
Exactly.
Wow. So that would imply that using multiple drugs might be able to slow the resistance development. Is that something that people are thinking about?
Yes, and this idea has been around, and that's why with, say, chemotherapy, we've generally had cocktails of chemotherapy to try to give the patient the best odds of beating the cancer by killing off cells that might otherwise circumvent the process through resistance.
So this is one of my examples that's made me so passionate about bringing an evolutionary view. Because when I was an intern, we treated lots of kids with Hodgkin's disease. And at that time, the oncologists were saying, we've got to use just one drug so we can save other drugs in case the first one doesn't work. And of course, the first one never completely worked, and most of these kids died. As I understand it now, triple drug therapy is pretty much standard and gives better results. Is that correct?
Yeah, this is the case for many cancers where they figured out what sort of cocktails can achieve cures and remissions.
It's really very much like antibiotic resistance and trying to get around the evolution that's happening.
That's right. And the concept of doing it up front versus waiting is something you brought up quite nicely there. And my own notion is more in agreement with yours. Use your best tools, and whatever all of those tools may be, up front.
Yeah. Good. Let's go on to the ecology angle in just a minute.
Sure.